Hello, I'm Dr. Robert Clark. For more than 30 years, I've had the privilege of sitting with thousands of seniors, navigating the challenges and triumphs of aging. And today, I need to talk to you about something incredibly serious, yet completely manageable. If you are over 65 and living with diabetes, there is a silent battle happening inside your body. It's a slow, quiet erosion of your most vital systems, your eyes, your kidneys, and your heart. The tragedy is that we have the tools to see it coming, to stop it in its tracks, but so many people don't use them. A recent study revealed a startling fact. Nearly 40% of seniors with diabetes miss at least one of the three critical, life-saving annual tests. These aren't complex, expensive, or painful procedures. They are simple tests covered by Medicare that can mean the difference between a future of independence and one of dialysis, blindness, or heart failure. This isn't about fear, it's about empowerment. Let me tell you about a patient of mine, a gentleman I'll call George. George was a retired firefighter, a man who had run into burning buildings his whole life. He was tough, and he figured his type 2 diabetes was just another annoyance he could muscle through. His blood sugar was a little high now and then, but he felt fine. He was busy with his grandkids, his garden, his life, so he'd skip his annual checkups. "I'll get to it next month," he'd say. One day, his wife called me, frantic. George's foot was swollen and red, and he hadn't even noticed a small cut he'd gotten while gardening a week earlier. That small cut had turned into a dangerous infection. It was a wake-up call. We saved his foot, but it was a close call that started a much bigger conversation. He'd been ignoring the warning shots his body was firing. The science behind this is straightforward but crucial to understand. Consistently high blood sugar acts like a corrosive agent on the inside of your blood vessels. Think of it like pouring sticky syrup into the delicate plumbing of your house. Over time, that syrup damages the smallest, most fragile pipes, the ones in your eyes, your kidneys, and the nerves in your feet. This is called microvascular damage. It happens so slowly, you don't feel it. There's no pain, no alarm bell, until the damage is severe. The good news? These three simple tests are like sending a tiny camera into those pipes to check for damage long before a catastrophic burst. They give us the power to intervene. So, let me ask you, have you ever put off a doctor's visit, hoping a small symptom would just go away on its own? Are you scheduled for your 3 critical diabetic checks this year? Your answer could define the quality of the rest of your life. Now, let's talk about the first and perhaps most well-known of these tests, the hemoglobin A1C, or, as it's often called, the HbA1c. Many of my patients think of their daily finger prick glucose test as their main grade. But that test is just a snapshot. It S like glancing at your car, SE speedometer for 1 second on a long road trip. It tells you how fast you're going right now, but it doesn't tell you your average speed for the whole journey. The HbA1c is your average. It is your 3-month report card, giving you and your doctor a clear, stable picture of your blood sugar control over time. For most seniors, we aim for a target between 7% and 7.5%, though this can be individualized. Staying in this range is one of the most powerful things you can do to prevent complications. I remember a patient, Margaret, a retired schoolteacher who was incredibly diligent. She checked her blood sugar every morning and was often frustrated when the number would be higher than she expected, even when she'd been good with her diet the day before. It felt like a daily test she was failing. When I explained the HbA1c to her, it was like a light bulb went on. She started to see that one high reading wasn't a failure. What mattered was the long-term trend. We started focusing on her HbA1c result every 3 months, and it shifted her entire mindset from one of daily anxiety to one of long-term sustainable management. She felt empowered, not judged by a single number on a glucose meter. The science behind this test is quite elegant. As sugar, or glucose, travels through your bloodstream, it naturally sticks to proteins. One of these proteins is hemoglobin, the molecule in your red blood cells that carries oxygen. A red blood cell lives for about 3 months. The HbA1c test measures what percentage of your hemoglobin has sugar attached to it. If your blood sugar has been consistently high over the past 3 months, more of your hemoglobin will be sugar-coated. So, an HbA1c of 8% means that 8% of your hemoglobin has glucose stuck to it. It's a direct, physical record of your average blood sugar levels. A practical way to think about this is that the difference between a 7% and an 8% isn't just 1 point. It represents an approximately 25% to 30% higher risk for developing serious eye or kidney disease. It's a number with real-world consequences. At your next visit, make sure you ask your provider for your 3-month A1C. So, I'll ask you to reflect. When was your last HbA1c test? More importantly, did you and your doctor have a conversation about what that number truly means for your health plan in the coming year? While the HbA1c gives us the headline story about your blood sugar, it doesn't tell us everything. Diabetes is more than just a sugar disease. It's a cardiovascular and metabolic disease. That's why the second part of this first test, a comprehensive annual blood panel, is so critical. This panel looks beyond sugar and gives us vital clues about your heart and kidney health. Specifically, we are looking at your lipid panel and your kidney function markers like creatinine. Ignoring these is like checking the air pressure in your tires, but never looking at the engine oil. You need the full picture to stay safe on the road. I had a patient named Frank, a man in his early 70s who was very proud of his HbA1c. He'd worked hard with diet and exercise to get it down to 7.2%. He'd come into his appointment smiling, holding up his logbook. But one year, his annual labs came back and I had to sit him down for a serious talk. While his A1C was good, his lipid panel was alarming. His LDL, the lousy or bad cholesterol, was very high, and his triglycerides, which are another type of fat in the blood, were through the roof. Frank was confused. "But Doc," he said, "I thought I was doing everything right." He didn't realize that diabetes itself creates a state of chronic, low-grade inflammation that makes the arteries more susceptible to cholesterol damage. His risk for a heart attack was significantly elevated, despite his good sugar control. This discovery allowed us to start him on a statin medication and work with a dietitian to specifically target those fats, drastically reducing his risk. The science here is about understanding that your blood vessels are a battlefield. Diabetes makes the inner lining of your arteries, the endothelium, sticky and inflamed. The bad LDL cholesterol is like a patrol of sticky-fingered soldiers who latch onto these inflamed walls, building up plaque. This plaque narrows the arteries, leading to heart attacks and strokes. The good HDL cholesterol, on the other hand, acts like a cleanup crew, scavenging cholesterol from the walls and carrying it back to the liver to be disposed of. Diabetes tends to lower your HDL and raise your triglycerides, creating a perfect storm for plaque buildup. As a practical example, think about a simple breakfast swap. Changing from a buttered bagel to a bowl of oatmeal with a handful of walnuts does not just help your blood sugar. The soluble fiber in the oats actively helps lower LDL cholesterol, and the omega-3s in the walnuts help lower triglycerides. It's a single change that fights the battle on 2 fronts. So, I want you to ask yourself 2 things. Do you know your last cholesterol numbers by heart, the same way you might know your A1C? And do you truly see your heart health as being inseparable from your diabetes management? We've talked about the blood, which tells us what's happening in your circulation. Now we need to talk about the body's filtration system, your kidneys. And for that, we turn to the second critical test. A simple urine test called the urine albumin to creatinine ratio, or UACR. Of all the complications of diabetes, kidney disease is one of the most insidious because it is almost completely silent in its early stages. You don't feel it. There are no symptoms. You can lose up to 90% of your kidney function before you start to feel sick. That's why I call this test the silent guardian. It stands watch over your kidneys, ready to sound the alarm at the very first sign of trouble. decades before you would ever feel a symptom. Skipping this annual test is like disabling the smoke detector in your house. You're flying blind. Let me tell you about Susan. Susan was a vibrant woman in her late 60s, known throughout her neighborhood for her spectacular rose garden. She felt perfectly healthy, full of energy. Her diabetes was reasonably well controlled. During her annual wellness visit, my nurse handed her the sample cup for her routine urine test. Susan almost waved it off. "Oh, I feel fine, doctor. Do we really need to do that?" I gently insisted, and it's a good thing I did. Her UACR result came back slightly elevated, in the range of what we call microalbuminuria. This is the earliest detectable stage of diabetic kidney disease. She had no swelling, no fatigue, nothing. But that number was a clear signal. Because we caught it so early, we were able to start her on a common, inexpensive blood pressure medication. Not for her blood pressure, which was normal, but because this class of drugs is proven to protect the kidneys and stop the progression of the disease. That simple urine test likely saved Susan from a future of dialysis and allowed her to continue tending her beloved roses for many, many more years. The physiology is fascinating. Your kidneys contain millions of tiny filtering units called glomeruli. Think of each one as a microscopic coffee filter. Their job is to clean waste products out of your blood while keeping valuable proteins, like albumin, in your bloodstream. When high blood sugar damages these delicate filters over years, the holes in the filter start to get bigger. Albumin, which is a relatively large protein molecule, begins to leak through into the urine. The UACR test is incredibly sensitive. It can detect even minute amounts of this leaking protein. This is our first and most reliable warning sign. A practical tip to make this effortless. When your doctor orders your annual blood work, specifically ask, "Can we also get the UACR test done from a urine sample at the same time?" You'll be at the lab anyway. One stop, two crucial tests. Now, take a moment to reflect. When you think about your diabetes, do you ever think about your kidneys? Or have they been out of sight, out of mind, simply because they haven't caused you any pain? The third and final pillar of our essential annual screening is the comprehensive dilated eye exam. And I must be very clear here. This is not the same as the vision test you get at the mall to see if you need new glasses. This is a medical examination of the back of your eye, your retina. Diabetic retinopathy is the #1 cause of new cases of blindness in adults in America. It is a devastating complication, but in its early and most treatable stages, it has absolutely no symptoms. You will not notice a change in your vision. Your sight can be a perfect 20/20 while the disease is silently advancing. The only way to find it is for a doctor to look. I'll never forget David, a retired carpenter in his late 60s. He came to me complaining that he was having more trouble reading blueprints in his workshop. "Guess it's time for stronger bifocals, Doc. Getting old is no fun," he chuckled. He hadn't had a proper eye exam in years. I immediately referred him to an ophthalmologist for a dilated exam. A week later, the specialist called me. David had moderately severe diabetic retinopathy in both eyes. He had hundreds of tiny, leaky blood vessels that were starting to damage his retina. He was on the verge of developing an irreversible condition called macular edema that would have stolen his central vision, the very vision he needed for his beloved woodworking. David was shocked, but because we caught it, he was able to undergo a series of laser treatments that sealed off those leaking vessels. It saved his sight. He still needed stronger reading glasses, but he was able to continue his passion, a gift that early detection gave him. To understand why dilation is so important, imagine trying to see inside a dark room by peeking through a keyhole. You can only see a tiny sliver. That's what a doctor sees when they look at your eye through your normal, undilated pupil. Now, imagine opening the door to that room and turning on the lights. You can see everything. The corners, the floor, the ceiling. That's what pupil dilation does. The eye drops temporarily wide in your pupil, giving the doctor a wide, clear view of your entire retina. The retina is the only place in the human body where we can look directly at your blood vessels in their natural state without any cutting. We can literally see the damage that diabetes might be causing. A simple, practical tip is to bundle your appointments. When you call your primary care doctor to schedule your annual physical, make your next call to the eye doctor to schedule your diabetic eye exam for the same week. Turn it into your annual health maintenance week. My question for you is this: when was the last time a doctor looked deep into your eyes? Not just to check your prescription, but to check the health of the precious tissue that allows you to see the faces of your loved ones. Let's take a deeper look at what exactly your ophthalmologist is searching for during that dilated eye exam. It's not just a casual glance. They are performing a meticulous, systematic search for the telltale signs of diabetic retinopathy. Understanding these signs can help you appreciate just how critical this yearly examination is. They are looking for changes that are as small as the period at the end of this sentence, but which hold enormous implications for your future vision. This isn't just about seeing clearly, it's about preserving your ability to live independently, to read, to drive, and to recognize the world around you. Let's go back to David, the carpenter. When his doctor looked into his dilated eyes, he wasn't just seeing a general picture, he was identifying specific abnormalities. The first things he saw were called microaneurysms. These are tiny, balloon-like bulges in the walls of the retinal blood vessels, caused by years of high blood sugar weakening the vessel walls. Think of them as the first tiny blisters of rust on a car's body. Next, he saw small dot and blot hemorrhages, tiny spots of bleeding where those weakened vessels had started to leak. The real danger, however, was the beginning of macular edema. The macula is the tiny central part of your retina responsible for your sharpest, most detailed vision. When the vessels leak fluid into the macula, it becomes waterlogged and swells up like a sponge. This is what causes the blurry, distorted vision that can make it impossible to read or recognize faces. The science behind this process is a direct result of that corrosive, sugary environment we discussed earlier. The blood vessels in the retina are among the most delicate in the entire body. High blood sugar damages the specialized cells, called pericytes, that wrap around these capillaries and give them their strength and integrity. As these cells die off, the vessel walls become weak, leaky, and unstable. In more advanced stages, the retina, starved for oxygen, tries to grow new blood vessels, a process called neovascularization. But these new vessels are abnormal and fragile, like weeds in a garden. They break easily, bleeding into the vitreous gel that fills the eye, which can cause catastrophic sudden vision loss. A practical tip for you at home: if you ever notice new, persistent floaters, sudden flashes of light, or if straight lines like a door frame suddenly appear wavy or bent, you must call your eye doctor immediately. Don't wait for your annual appointment. These can be red flags for serious problems. So, reflect on this for a moment. Do you tend to dismiss small changes in your vision as just a normal part of aging? Or do you understand that your eyes provide a direct window into the health of your entire body? Now, I know what many of you might be thinking. This all sounds great, Dr. Clark, but what is it going to cost me? Navigating the healthcare system feels overwhelming. This is a completely valid concern, and the stress of worrying about medical bills is real. But here's the wonderful news. Medicare was designed to help you stay healthy, and it covers all three of these essential tests. You simply need to know how to navigate the system. Understanding your benefits is just as important as understanding your medical conditions. It's a key part of your treatment plan. Let me tell you about Maria, a patient of mine who was living on a fixed income. She was hesitant to schedule her appointments because she'd once received a surprise bill from a specialist and was terrified of it happening again. We sat down together and I walked her through it. Medicare. Part B, which covers your outpatient doctor visits, covers an annual dilated eye exam specifically for diabetic retinopathy. It also covers your HbA1c and other lab tests, often up to twice a year if medically necessary. The key, I explained to Maria, is to use the right language. When you call a doctor's office, you need to ask one simple, powerful question. Do you accept Medicare assignment? This is a magic phrase. It means the doctor has agreed to accept the Medicare-approved amount as full payment. They cannot bill you for anything more than the standard Medicare deductible and coinsurance. If they don't accept assignment, they can charge you much more. This knowledge transformed Maria's confidence. She felt in control. The next time she needed to schedule her eye exam, she called the office and asked that exact question. The receptionist said yes, and Maria went to her appointment with peace of mind. For those who might be uninsured or find the copays challenging, there is still help. Look for federally qualified health centers or community health centers in your area. They are designed to provide care to everyone, regardless of their ability to pay, often using a sliding scale based on income. Here is the connection to your health. The financial stress of managing a chronic illness can raise stress hormones like cortisol. Cortisol, in turn, can make your blood sugar levels harder to control. So, by taking the step to understand and use your insurance benefits, you are not only protecting your financial health, but your physical health as well. I want you to ask yourself, have financial worries ever caused you to delay or avoid getting a necessary medical test? Do you feel empowered and prepared to speak with your doctor's office about billing and insurance coverage before your next appointment? We've covered a lot of ground today. The 3 critical tests, why they matter, and how to access them. But knowledge is only powerful when it's turned into action. Seeing the numbers on a lab report is not the end of the journey. It is the beginning of a new, more informed one. These results are not a grade of success or failure. They are your personal roadmap, showing you exactly where you are and helping you and your doctor chart the best course forward. This is where hope and control truly begin. Let's imagine a hypothetical patient, John. He's 72 and has had his annual tests. His results come in, his HbA1c is 8.2%, well above the target of 7.5%. His UACR urine test is 45 mg/g, indicating early kidney damage. And his eye exam shows mild background retinopathy. Now, John could look at these results and feel defeated. But that's the wrong approach. Instead, we see this as an incredibly valuable set of instructions. This is the warning shot George never had. John's roadmap is now clear. First, the 8.2% HbA1c tells us his current medication or lifestyle plan isn't quite enough. We need to have a conversation about adjusting his medication, or perhaps meeting with a registered dietitian to find new strategies for his diet. Second, the UACR of 45 mg/g is our signal to start a kidney-protective ACE inhibitor medication immediately to prevent any further damage. Third, the mild retinopathy means we won't wait a full year for his next eye exam. We'll have him see the ophthalmologist again in 6 months to monitor it closely. Do you see the difference? Without these tests, John would have continued on his current path, feeling fine, while silent, irreversible damage was occurring. With these tests, he is now on a proactive path of prevention. He is in the driver's seat. This is the entire purpose of screening. It is not to find disease, but to prevent disability. It's about ensuring you have many more years of seeing your grandchildren's faces clearly, of having the energy to walk in your garden, and of living with vitality and independence. So, let's recap. The HbA1c blood test, the UACR urine test, and the annual dilated eye exam. These are your 3 pillars of proactive diabetic care. They are your early warning system. Please do not wait for a symptom. Symptoms mean the damage is already advanced. Take control of your health story today. Call your doctor's office and schedule these tests. It is the most important promise you can make to yourself and to the people who love you. Thank you for your time, and please subscribe for more clear, practical health guidance to help you thrive in your senior years.